Polaoffice is a simple-to-use in-office tooth whitening system requiring minimal chair time. Whiter teeth are achieved in just 30 minutes. This video demonstrates and provides information which will assist you in preparing the patient for the Polaoffice whitening procedure. Before starting treatment, carefully review the patient's medical and dental history. Thoroughly discuss the benefits, risks, advantages, disadvantages, and the perceived final outcome of each treatment option that is available. To assist you, a treatment checklist and informed patient consent form is available for download on the SDI website, www.sdi.com.au. Go to the Tooth Whitening Polaoffice tab in the Products menu for this information. If the patient has a history of sensitivity, you may want to prescribe a desensitizer such as SDI Soothe for half an hour prior to beginning the whitening procedure. Prior to starting the procedure, please ensure you, your staff and the patient are wearing appropriate protective eyewear, gloves and masks. Review and explain the whitening procedure and be certain it is understood by the patient. With the patient, determine and record the pre-whitening shade of the teeth using a Vita shade guide in order of brightness as opposed to the standard arrangement. We recommend at this stage a before photo be taken. This will provide a starting shade reference to be compared to the post-operative shade. Assemble all of the material you will need for the whitening procedure, including Vita shade guide, patient mirror, air water syringe tip, cotton rolls, cheek retractor, petroleum gel, Profi cup and flour-based pumice, saliva ejector, Polaoffice kit, timer, high-speed evacuator, vitamin E or slurry of sodium bicarbonate. Clean the teeth with a Profi cup using a flour-based pumice that is free of glycerine and fluoride. Your goal is to remove plaque and debris from the teeth to allow the whitening material to stay in close contact with the tooth. Thoroughly rinse the teeth to remove all the pumice. Place cheek retractors and cover exposed lip surface with petroleum gel. Be certain as much of the lips as possible are retracted by the cheek retractor. Cotton rolls may aid in protecting the lips from coming in contact with the whitening material. Dry the teeth and gingiva using your air water syringe. Once dry, slowly apply gingival barrier to both arches. Overlap the enamel and interproximal spaces by about ½ millimeter, paying extra attention to interproximal spaces. After this first application, apply another level of the gingival barrier until it extends about 3 millimeters on the gingiva. Light cure the gingival barrier in a fanning motion for about 10 seconds until cured. Use an explorer or other instrument to be certain all areas are cured. Once mixed, Polaoffice gel is effective for 20 minutes. Therefore, it is important that the liquid and powder are mixed just prior to being applied to the teeth, away from the patient. Have a timer ready. Open the powder pot. Take one Polaoffice syringe and firmly attach a tip. Carefully pull back the syringe plunger to release pressure. Carefully extrude the contents of the syringe into the pot. Immediately